Welcome to Independent RX Forum with the National Community Pharmacists Association, America's leading advocate and business education provider for independent community pharmacists. Independent RX Forum is powered by RX Connection.
Hello and welcome to Independent RX Forum, the official podcast of the National Community Pharmacists Association. I'm your host, John Beckner. We're glad you could join us. Today we bring you part 2 of our series on the evolving role of the pharmacy technician, and my guest again is Meredy Ayers. Meredy is a certified pharmacy technician, and you recently changed jobs. Congratulations
Thank you.
on that transition, and I want to talk a little bit more about that. You spent, I guess, a little over 2 decades working in independent pharmacy. What did you learn from that experience? 2 decades is a long time.
It is. It's a very long time. The biggest thing was relationships. Working in a community pharmacy, you get to know your community, and you get to know your coworkers that come in and out, and you really get to know the world of pharmacy through community pharmacy. And I think that was the biggest thing for me, and kind of a cool transition into what I'm doing now. But for 26 years, I got to know people and realized how many people knew each other, which was huge. So that's been a huge thing for me. And you get to utilize those people to kind of solve problems you didn't know existed before. And then you get to jump in and help and solve those problems. And it was all about patient care and advocacy. And I had a great time doing that.
So how did working in a community pharmacy or several different community pharmacies shape the way you think about patient care? Patient care is such an important term today in terms of what the service that pharmacists and technicians provide. How did that shape your own thoughts about patient care?
You see the patient, the patient, and you can see barriers or things that work for one and not the other. And so it's neat to figure out that puzzle. And that is really kind of what my 26 years was taking the patient care and saying, okay, how can I help this person out? And utilize this in a bigger picture too. So it helps a larger group of people.
Right.
And so that's really been a key focus for a long time.
So you recently made a big transition, big decision to change. You worked at a pharmacy where you were afforded a lot of different opportunities outside of the traditional technician role. And before we talk about that transition, I think it would be beneficial to our listeners if you shared a little bit about all the different things that you were involved in there as a pharmacy technician. I'm sure it'll give people a perspective about, wow, technicians can do all that.
So my role started as bedside delivery in a hospital setting at this pharmacy. And we were doing a lot of people that were leaving the hospital and needed meds before they went home. We wanted to save them a trip. And that was part of helping the patient. And then that grew into an opportunity to work with medical billing and reconciliation, things like that, more print and paper. And then it moved into a community engagement role and marketing and social media, and then really transitioned into helping other technicians in our company and growing them. And then I think one of my favorite parts was teaching a pharmacy technician course. One of my favorite things I did, and utilizing all of that in our community to tell people the other things that community pharmacy can offer.
Right.
So it was really what I did maybe the last 5 of the 12 years I was there, was educating the community on everything that there was to offer.
And you did a lot of public speaking.
A lot of public speaking, a lot of local public speaking.
And I've heard you. You did a great job.
Thank you. Thanks to you. Done some things on the national level, some podcasts with you, and then a lot of things in Richmond to kind of get the word out. People don't realize what your pharmacy can do. So it was a lot of just fun networking and getting to know people.
All right. So that sounds like a great position to have. Why did you decide to transition out of that to doing something, I guess, is it accurate to say totally different?
Totally different. It was a lot of fun. 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 It was a lot of fun I didn't see it coming, and it was kinda neat how it happened, but I also felt like it landed in my lap, and I thought it was a really cool next step, and it left an opportunity to still, help the pharmacy I was at and community pharmacy as a whole, and then really dive into compounding and advocating for it and kind of changing, my role in pharmacy. So, not necessarily patient fronting anymore, but I'm still living in my community and I still see the people I saw before. So, being able to educate that way has been really nice.
Yeah, well, that sounds like a good position to be in, and it also sounds like it was first glance, it may have been a difficult decision, but at the end of the day, it might not have been so difficult in terms of the right time, right place.
It was definitely good timing. I adored the pharmacy I was at, adored it, and could have stayed there forever. If this hadn't landed in my lap, I'd still be there. And I think it was just a great transition. The relationships are great, and so I've been able to keep that. And with the new place that I'm at, I think we'll work well together, and help advocate for things for that pharmacy as well. So I think it's a good relationship.
Yeah.
No burn bridges, so fantastic
You
opportunity
never
there.
wanna burn bridges.
No, and they're all my friends and family, and I'll always think of them that way. So, um, yeah, leaving was very, very, very difficult. That was rough to even make that decision and break that news.
Right.
But I think it was a really good decision for the new stuff that I'm doing, and I'm really excited about the new stuff.
So you're working for the Alliance for Pharmacy Compounding, APC. It's
Correct.
an association that represents the nation's compounders. Uh, what surprised you the most about getting into associational work? And, I could talk to you about my experience because I was in operations for many, many years and spent the last 12 years at NCPA, working for association. So what surprised you about it?
Um, so what surprised me was how many people I can affect at once.
Mm,
I'm so used to doing patient by patient. And now I can do it as a group, which is fantastic and do a lot at one time. Um, but what wasn't surprising was how how important these associations are to pharmacy.
right.
And I'd been involved in volunteering with associations, state associations, local associations, and so I wasn't surprised at the good work, but I was surprised at how much I can impact at once. And that's been fantastic so far.
So you're having an impact, but just in a different way. So
Definitely.
so what does APC do for its members?
So they advocate and support compounding pharmacies all over the country, education, resources, legislation, really making sure policymakers understand what's going on with compounding rules and regulations,
Sure.
and really how compounding plays a part in patient care and how important that is. And APC does a great job at that. And I'm still getting my toes wet, but fantastic.
So in today's healthcare landscape, compounding really does have a pretty significant role.
Fantastic role, yeah. It's you have to understand when there's not a standard option for somebody for a medication, compounding can fill those gaps.
Right.
And it's a great resource, whether it's dosage, formulation, availability. It's personalized, which is what patients sometimes need. And it's something that's not necessarily, it's a system that's standardized in compounding, but can be done individually for a patient, which is the most important part, is getting them what they need.
So I'm not sure, I mean, maybe you can share with their listeners exactly what your role is, but the compounding is a highly regulated uh, part of pharmacy. Pharmacy is a highly regulated profession, but when it comes to compounding, there are even additional.
More and more every
Yeah,
day.
yeah,
My role is to engage and get people understanding more about what we do and getting involved if your pharmacy is compounding to make sure you're up to date, and that you're following the regulations and we're doing the right thing by compounding, and making sure that there's no misunderstanding about what we can do, what we can't do. And APC does a great job educating people on that with different resources, webinars, out at different shows, representing all over the country. And it's important to know compounding is an option for your patient. So getting involved with knowing what you can do, and what you shouldn't do, and keeping those lines separate.
So are you going to be, I know you've only been there, what, a month?
4 weeks.
So are you going to be involved in APC's advocacy efforts on the Hill? Is that part of what your responsibilities are?
I'll be helping run the event, Compounding on Capitol Hill in September. I am not scheduled out to be at any event prior to that, but we shall see.
Yeah.
We'll see what happens. We're 4 weeks in.
It's early, right?
It's early. We don't know.
So what do you think, just looking at the landscape of compounding, what do you think some of the biggest challenges are facing compounding pharmacies?
Regulatory pressure is huge.
Yeah.
And it's changing every day, and misunderstanding, and getting the right people to understand the right things and what they need to understand.
Right.
There's a lot of things happening that don't always include the people doing the work. And it's important to get those people involved. And so that's where we come in. And that's really where advocacy is critical, is getting the right people in the right room with the other right people and making sure that those people are part of the decision making,
Right.
making sure it's done correctly.
So what about reimbursement pressures? I mean, that cuts across
Everybody.
Yeah.
I think that's going to be an ongoing thing. I don't see an end in sight anytime soon, but as in regards to compounding, it's very different. And it's a different landscape altogether, and how it's billed and how it's reimbursed. And so you do run into places that are not utilizing it, and then you run into some that are, and so it's still a gray landscape there.
Right.
Yeah.
So I'm going to have you put you've got your association hat on right now, but when you were at your previous job, you were very involved with NCPA and folks at NCPA in terms of speaking, and now you're involved with the Compounding Association. Looking at associations across the spectrum, what do you think associations could be doing better for the folks that they represent?
I think there's a need to connect with the members, and even those that aren't members, to become members and understand how important it is to be a member of these associations that really affect your day-to-day, your business, your career. And then I think it's important for associations to make sure members feel supported, not necessarily just represented, but actually listened to and supported, and that those things are coming across to the people that need to hear them.
Yeah.
And making sure that we continue to do that and do an even better job than a lot of associations currently are.
Yeah, and a lot of people that are, I guess, their day-to-day jobs, they don't necessarily see everything that goes on at the national level that associations provide.
Correct. Getting outside of the four walls is huge.
Yeah.
Very important. And I think that's really what pushed me into making the decision that I did to go to this association was you don't realize how quickly these decisions can impact day to day in your pharmacy. So being a part of that, being at the table and understanding it better is super important, and how it's directly going to affect what happens in your pharmacy tomorrow and how quickly these things can change. And we don't even realize it. So it's important to get outside of the four walls and learn more about what your pharmacy does as a whole and how it affects the entire pharmacy community.
And join.
Definitely join.
Membership's always important.
Definitely.
So one last question, and you can elaborate. Do you miss what you did in your previous job?
I miss it.
Because you were very good at it.
Thank you.
You were passionate.
I think it's still fresh.
Yeah.
So in my brain, I don't feel like I've stopped doing it yet. Yeah. And I'll never stop advocating for that pharmacy. I'll never stop recommending it to people where I live. I'll say, oh, I know this great pharmacy. You should go there. So it hasn't quite hit yet, but it will. I still get messages from people I worked with, not even coworkers, but people I worked with in the community, just checking in, and it's neat, the relationships that form. So
it'll make you feel good.
It does, and it makes you miss that work together. But I'm excited about the work coming up and the new people I get to meet. So
yeah, well, I'm excited for you. I think you're a great example of someone who's taking advantage of the opportunities that have been presented to you, and you've shown a lot of initiative, and you've not been afraid to step outside of your comfort zone.
No, and I can give some thanks to you for that.
Well, I don't know about that, but you seem very comfortable doing the podcast.
Absolutely.
Yeah, so thanks, Meredy. I appreciate it.
Thank you, John.
And thanks to you all who tuned in, and we encourage you to listen to Independent RX Forum on whatever podcast forum that you use. Thanks again for tuning in.